Yes, now we go ahead with the second session today, and that is on organon, and we'll talk about potency, dose, and repetition. It's a very vital topic, and we shall try to do a little justice to the practical considerations for our homeopathic practice. Potency and dose, in short, repetition is implied. So here this is categorized into these 7 subtopics. One is gradation, then apathetic approach towards potency, dynamic versus organic pathology, susceptibility and potency, acute diseases, then other conditions, and dose. Now about gradation. So normally whenever we say he says he uses high potency, he uses low potency. So the potency is to be categorized into 3 grades. One is low potency. We must know and we must be clear in our mind that what is a low potency. So low potency, as per one concept, it is a potency below Avogadro's number. But Avogadro's number is 12. So those potencies, instead of telling like that, we say that below 30. So below 30 is 3, 6, 12 and 18. These are the potencies which are found in Calcutta. But commonly 6 potency is available, 12 and 18 all potencies are not available. So below 30 is 6 potency. Then medium potency is simple, 30 and 200, because they are borderline. From 30 it goes towards low, from 200 it goes towards high. So the medium is 30 and 200 potency, and high potency is above 200, which means 500 potency. Does any one of you have 500 potency? No, we have 500 potency. I have pure culinum in 500 potency. I have carcinosin. Many remedies are available in 500 potency, only because after 200 suddenly you go to 1000. So instead there is a 500 potency, but not very popular. It is available in Calcutta. If you want, you can get 500 potency from any publishing company. Then 1M, 5M also is there. 5M is again more rare, but more common is 10M, 50M and CM potency. There was a DM potency also earlier. So this in a way then Kent introduced the term octave. Octave is like notes of music. There are 8 notes of music. No, in Hindi there are saptasur 7, but in English music there is an octave. Do, re, mi, la, like that. No, there are 8 notes. Huh? So similarly, 8 potencies you can say. So this 1, 2, 3, 4, 5, 6, 7, and 8. So somebody may start from here and in between go to DM. So like that, 8 range of potencies. So there is a range of potencies. So that is the gradation, which is clear in our mind for our understanding. Now, after this gradation of potency, we go to apathetic approach towards potency. Now, apathy is carelessness. What to do? Whichever potency you do, whichever potency you give, if the medicine is correct, then it will work. So they say that selection of medicine is the most important. Medicine must be correct. Any and every potency works. So this is what some people say. Then they say that it is very difficult to store all these potencies. So for the purpose of ease of storage, you keep either low potencies, all medicines in low potency, 6 potency, or you keep high potency, all medicines in high potency. And for that they say best is medium potency, because, and that is what is actually, most of the practitioners are having 30 and 200. So 30, 200 are medium potencies. So they say that best is the medium potency. Then there will be some people who say mother tincture is the best potency, because mother is the best. So if the mother is the best, then the mother tincture is the best. But that is something which is a layman's talk. Now on this, there are certain questions which come to our mind, and that is what I have enlisted them as a query. Questions. There was a patient, this from Dr. SPD's book, that unbearable acute headache. Symptoms of belladonna were present. Belladonna 30 was given with slight or no improvement. And this you can find in your day-to-day practice also. But belladonna 1M and 10M gives magical result. The headache disappears. Then abdominal colic. Colocin 30 or 200 you give and no effect is there. You give 50 ml, it gives magical result in abdominal colic. Then bacillary dysentery. Merck or 30 you give, it does not give any result, it fails. But give Merck or 1M and it is successful. On the contrary, there is opposite side also. Skin disease. Sulfur 200 or 1M, tremendous aggravation. All itching, patient runs away from you and never comes back to you. Then sulfur 6 in repeated doses, little relief and patient goes towards cure. Paralysis, high potency, no result. Low potency in repeated doses shows result. Now this particular experience makes us think that no, any and every potency is same, is a layman's talk. It is an ignorant person who doesn't know, and that is why we have to think, we have to try to understand that why it is so. So this apathy towards potency is no good. Then to understand the concept of potency more, we have to appreciate this pathology business, that is dynamic pathology and organic pathology. What is dynamic pathology? A stage between period of onset of disease up to just the beginning of organic change. If the disease begins, suddenly disease will not begin in a full-fledged form. So first when the disease will begin, it will have only functional changes. And after that disease grows, a stage will come when the organic complaints will begin. Then what is organic pathology? From onset of organic change to ultimate change, organic ultimate, when the stamping is done, when you see there is a degeneration, there is a proliferation, there is a tumor or whatever organic change has taken place, and that leads to organic structural pathology. So this thing we have to keep in our mind, that there is a dynamic pathology and there is a organic pathology. So when you talk of which potency to give, first of all you try to conceptualize that the patient, the person, the disease for whom you want to prescribe, it is in which state, whether it is in dynamic state, dynamic pathology state or organic pathology state. Then we go to most important question next is the susceptibility. Relation of susceptibility with the potency. Susceptibility many times in Organon was a very loose term. We will make fun of susceptibility. We will go and discuss about susceptibility in a restaurant. We will go and discuss about susceptibility in cinema talkies, and we will go and discuss about susceptibility in playroom. But then we will do everything about susceptibility at every place except the time when we are prescribing. For prescribing, we will not consider susceptibility, and that is something very bad. Let us now think that different angles. One is when nerves are strong, in the highest tune, the nerves are strong, in the best possible condition. 6 or 30 if you give, there is no relief in 1 to 2 days. Whereas 1M or 10M gives wonderful result when nerves are strong. 1M and 10M gives wonderful results. If low potency is repeated again and again, then what happens? Susceptibility can be increased in drug proving. What is happening? We are repeatedly giving a low potency. A person does not have any disease, he is a healthy prover. So in him you are giving repeated, and as a result after repetition what happens? The changes come, but that is in the low potency. So if low potency is repeated, susceptibility can be altered. Then second premise here is susceptibility is intact in dynamic pathology. That is, when the disease has reached only dynamic level, not the organic level, a single dose of high potency shows action. Single dose of high potency shows action here. And repetition of high potency, it causes adverse effect. If you repeat high potency, then there is aggravation because the susceptibility is intact here. Third premise is in neurotic patients. Now, neurotic patients means in our knowledge we understand anxiety patients. Susceptibility is high. And action obtained by single dose of high potency is there. Single dose of high potency also gives action. And if repeated again and again in high potency, patient will become incurable. It will become a mess. If you give high potency to a neurotic patient, repeated doses, then it will become a mess. But simply if you say high potency causes this, that is a half truth. You have to qualify the condition. In whom? So here it is neurotic patient, repetition is harmful. Fourth premise is idiosyncratic patients, not allergic patients. Idiosyncratic patients. Idiosyncrasy is a typical constitutional fault, and in which there is to each and every medicine in every dose patient reacts. In them, susceptibility is very high, very high. So olfaction of a few globules of 30th potency for a few seconds kept before the nostril is sufficient, and it should be repeated at long intervals of weeks and months. There are patients who are idiosyncratic, few of them, and on them this olfaction experiment should be done. Is it understood? Then we continue. Next premise, nerves are affected in paralysis also. See, nerves, when there are high tone, well strong nerves, and there is nerve paralysis also. In paralysis, the continuity is broken, the injury is there, but susceptibility is low here. In paralysis, susceptibility is not high, susceptibility is low. Earlier, the susceptibility was high, but in paralysis also is a disease of nerves. But here it is low susceptibility because it is reciprocal 1 upon infinity to etiology. So etiology, whatever is etiology, the cause, so it is reversed to the cause. If there is a destruction, then susceptibility becomes low. If there is an inflammation, then susceptibility becomes high. So see, nerves are damaged. The damage of nerve is of different types. One is destruction. Do not generalize destruction with syphilis. Remember one thing. That is what we have discussed in the first lecture itself. That's a wrong training which we have been given. That degeneration or destruction is syphilis and inflammation is psychosis and function is sora. No. Forget about that. Let us talk of pathology. So when we talk of pathology, we find that in destruction the susceptibility is low, and in inflammation the susceptibility is high, because in inflammation the process is active. In process is active here. In hemiplegia, paraplegia, brain tumor, these are paralysis conditions, give low potency. Learning main lesson here is that in such conditions give low potency because of these reasons, and not over 30, but you are to repeat it because the action will be finished. So repeated low potency 30 doses in hemiplegia, paraplegia and brain tumor, whereas in Bell's palsy it is called, then other paralysis of unknown etiology where cause is not known, give high potency with repetition. Repetition is required here also, but of high potency to remove the benumbed condition of nerves. Nerves have been benumbed. They have been rendered in a disadvantageous condition, and or to soothe the excited condition of nerves. It can be either excited or it can be benumbed. In both, repetition is required, and in fact 50 millisiemens potency is good here. because we are discussing the dose and potency with special reference to centesimal. Because even if I tell you to use 50 millisievert potency, I know it will not be possible for you to use routinely 50 millisievert potencies. The bulk will be centesimal. So this lecture has been drafted to suit the users of centesimal potency. Is it clear? Next, acute disease. Now in acute diseases, susceptibility is generally high. Very simple, because fresh, disease is fresh. First of all, there is no organic change, and if at all there is an organic change, it is temporary and it is reversible. It is not irreversible. So high potency repeated at suitable intervals deliver rapid results. Don't generalize this. Don't think what you will do in acute disease will be done in chronic disease also. In acute diseases, the nature is different, the symptomatology is different, the picture is more clear. Secondly, the prescription in acute disease can be more accurate because the symptoms are fresh in the mind of the patient. He tells the symptoms himself, they are prominent, they can be verified, they can be objectively checked. So as a result, your matching of symptom will be more. So that is what is they say, the higher the similarity, the more the potency. The higher the susceptibility, the more the potency. So high potency repeated at suitable intervals. Example is of say viral, that is influenza. Rustlox 30, if you give in viral fever, it may take 3 to 4 days. Whereas Rustlox 200 or 1 m may do the work in 1 to 2 days. You can see it in your own practice that when you prescribe in low potencies and when you prescribe in high potencies in acute conditions, of course the symptoms have to be similar, your medicine has to be correct, that is a presumed issue. We are talking of potency, no? Then potency need not be high in all types of acute disease. How? Because say cholera, severe diarrhea, prolonged and profuse hemorrhage, where the vitality is low. Here the vitality is low, susceptibility is low, and therefore use 3, 6, 12 or 30. Low potency has got to be used here. Then colic or unbearable pain. In colic or unbearable pain, when there is organic cause, then use low potency. If no organic cause, then use high potency. Colocin, intestinal colic, no organic cause, high potency. But if there is gallbladder inflammation, if there is other organic reasons, renal calculi, or any organic cause, in that your high potency instead of high potency, low potency will give you better result. So that is about acute disease. Then we go to some other conditions here. Now in other conditions, say primary stage of psoriasis, syphilis and psychosis, that is itch, malaria and syphilis. In these conditions, you have to repeat high potencies in centesimal. Whereas in 50 millisimal, you are required to give the medicine in a glass when you are making, and from there you are taking 2-3 spoons, rather dessert spoons, and diluting it further. Don't dilute. Instead of dilution, take it direct. So that is what is the instruction of Hahnemann in 50 millisimal potency insofar as the primary conditions of these miasms are concerned. In centesimal, you have to repeat high potency, and over there you have to repeat full doses. In tumors, warts and growths, low potency in repeated doses. This is a very important lesson, that in these conditions you first of all give low potency in repeated doses. Once you start getting results, then that low potency will stop working. As a result, over there you are required to give higher potency for removal. Now this model you cannot apply to all conditions. This model you cannot apply to all conditions. Otherwise, if you apply this model to all conditions, then the lesson will be so for removal, as I have told, after repeated low potencies, we have to go to higher potency for removal. Then advanced cases of cancer and sarcoma also, remember, use low potencies here. Do not use high potency medicines here, because otherwise what will happen, that it will be aggravation will be there. And finally we go to the dose consideration. Now in dose consideration, many times people are confused. What is the difference between those? Whether you give one globule or 10 or 20 globules or one full bottle, what is the difference? No, it is not so. Single dose is 4 globules or full drop, or one globule of 10 or 20 size has been prescribed, told by anyone. Now people argue, as I have said, one globule is equal to 6 globules. And in 50 millisieverts potency, 1 teaspoonful is a dose, and there is a difference of mouthful dose. That is, instead of 1 teaspoon, when you want greater action, what you ask the patient to take, say 1 mouthful dose, which is equal to about 1 ounce. If you take 1 ounce, then there is a mouthful dose. All these are important, provided there are two things. Number one is that your medicine which you are prescribing is indicated medicine. That is, symptomatology matches. Number two, the patient to whom you are giving, that patient is susceptible. That is, that patient is sensitive. His susceptibility has got to be there. If he is a person who is taking narcotics, who is taking drugs, or who is taking a lot of allopathic drugs, then in him, if you prescribe, then your medicine may work, may not work. So those considerations are very important. Then secondly, many times patients come to us, Doctor, my daughter has taken one full bottle of homeopathic medicine. What to do? Many times children do it, and when we were children, we also did it. So that is somehow what happens? Nothing happens. Why? Because he is not a patient. And when you are not a patient, then you are not sensitive to that drug. So unindicated medicine will not do any work. So because of all these things, our conclusion is wrong drawn. There is a doctor, now he is no more, he was a relative of mine, he said that his father, his distant was my grandfather, so he was a famous homeopath. And this doctor about whom I am talking, he was an allopath subsequently, but when he was a student, he used to sit with his father and dispense medicines. So he said, I will test him, instead of giving A medicine, I will give B medicine. And the patient will come and say, next day I am better. So he made his own experiments and concluded that all this is nothing. Whether you give this or whether you give that is nothing. So we used to say that this is a premature experiment. Well, who is doing this experiment? A student of school. So whether this research is conducted properly, and today that is what is happening in homeopathic world also, that there is a challenge, great challenge in UK and in France, etc., where they are conducting the trials of homeopathic medicines and declaring that these medicines do not act. The way today homeopathic medicines are made in form of combinations. I make a combination of aconite, belladonna, bryonia, and all these medicines of cold, and write a name cold mixture and sell it like a cold mixture. If I conduct an experiment and give it to 1000 people and see how many people respond to it, the answer will be big zero. Whereas if you do it with aconite and it does not act, you have an answer, because symptomatology of aconite is not there, that is why it is not acting. So it has to be on the symptomatology of aconite. But about these combinations, what are the symptomatologies? Nothing. There is no ground, and without this ground you are required to prescribe. So these things are killing homeopathy, somehow we have just changed our topic, but coming to the topic of dose, we must remember that all misunderstandings are caused because of incomplete understanding of the things. Homeopathic single globule and a large number of globule may not make a difference, but if it touches a larger number of nerves that is in liquid, then in place of 1 spoon, if you give 1 ounce, then it will have a bigger action. That is why finally Hahnemann from globules went to liquid, because more number of nerves was affected. So that is all about our potency, repetition and dose. If there are any questions, you can ask them.